Good morning, everyone. Thank you for joining us. Another meeting from Zoom. We're still not in person and not sure when that's going to happen, but we can't thank you enough for participating. For many months, the Education Committee of BWGC has been studying disparities and inequities in health and wellness. We continue today with our quest for knowledge, understanding, and how we can help level the playing field by welcoming Dr. Dzirasa, the Baltimore Commissioner of Health. She's a Johns Hopkins trained pediatrician who believes that equitable care is a basic right for all and continues to tirelessly advocate for programs that support the overall health and well-being of all city residents. Dr. Dzirasa's interests include obesity management and prevention, trauma-informed care in children and adolescents, and expanded use of technology to improve health outcomes.
Thank you so much, Dr. Dzirasa, for joining us. Just a couple of quick housekeeping. The meeting is being recorded. Dr. Dzirasa will share her slides, and we will ask any of you who have questions to please put your questions in the chat. And when we are finished, I will assist her in asking questions, or she's welcome to look at the chat herself. And then I will be muting everyone. So Dr. Dzirasa, please unmute yourself when you talk. And one more quick thing. I wanted to thank Dr. Dzirasa again for being here. I also wanted to thank all of you for being here, and a special thanks to Winnie Borden and Harriet Stillman for all of their tireless work gathering speakers and helping us through this somewhat challenging but amazing year. So thank you, and please go ahead, Dr. Dzirasa. We really appreciate your time.
All right, I'm going to go ahead and share my screen.
Oh, she's cute.
And hopefully you guys are seeing my title slide. Are we good to go?
Give me just a minute. I'm actually going to mute everyone, and so you'll have to unmute just so.
All right.
All right, thank you.
All right. Good morning again, everybody. Thank you all so much for the invitation to participate. I'm very excited to be here today to talk about the work that we're doing at the Baltimore City Health Department. Again, my name is Dr. Letitia Dzirasa, and I'm the Commissioner of Health for Baltimore City. I've been in this role now for exactly 3 years. So I started in March of 2019, just 1 year prior to the pandemic beginning. And so have certainly learned a lot and had many experiences in my short 3 years in this role. Excited again to talk about a lot of the work that we're doing today at the health department around our COVID-19 response. So briefly, I will talk about our organization, the Baltimore City Health Department. I'll give a high-level review of our mission, our vision, and our values. Then I'll delve into our COVID-19 priorities. I will spend some time talking about our vaccination efforts and some of the inequities we're seeing in vaccination, as well as our testing efforts. And there should be plenty of time at the end for questions. So beginning with our mission and vision, and I start here because I think that this really centers us as an organization, and it's how we think about and approach our work. So our mission, and we revamped this statement shortly after I started in May of 2019, is to protect health, eliminate disparities, and enhance well-being of everyone in our community. And we do this through education, we do this through coordination, we do this through advocacy, and we provide direct services. Our vision is an equitable, just, and well Baltimore, where everyone has the opportunity to be healthy and to thrive. We have created a strategic approach that is focused on improving health and eliminating disparities. And we have 5 core components of that: addressing racism as a public health issue, implementing a health in all policies approach, considering health across the lifespan, and internally strengthening our operational capacity to support our programmatic success, as well as improving outcomes and inequities across key health issues. Again, shortly after I started in May of 2019, we underwent an exercise to identify what our core values are as an organization. Again, I think this is so critical because it drives the work that we do. So we talk about being data-driven. We always want to ensure that we are looking at the data, we're looking at the outcomes to determine what our next steps are, to determine if the work that we're doing is actually making the difference we hope it's making. We operate with integrity. And so again, we hold ourselves accountable for what we said that we want to do and how we want to serve others. Innovation, we strive to be innovative in our approach in providing services to the community and to our residents. We are collaborative in nature. This work does not happen in a vacuum, and the health department does not ever work alone. We are often working collaboratively with our healthcare system, with our federally qualified health centers, with community-based organizations, with the philanthropic community to achieve our goals of decreasing inequities. And then lastly, we aim to empower the community that we're serving. And so I mentioned at the beginning being data-driven, but we're also community informed. So we want to incorporate and include the community in all of the programs that we're designing. So again, we make sure that we're addressing the needs that they've identified. So shifting gears to talk a little bit about our priorities with COVID-19, again, through our lens of what our mission, vision, and values are, we knew that going into this pandemic, there were going to be inequities. And so we have focused on how do we drive down those inequities, specifically ensuring that every resident has fair and just access to vaccinations, boosters, and our testing resources. As I mentioned, we strive to be data-driven and community-informed. So we want to be evidence-based in our approach. We want to ensure that we are reflecting the most up-to-date science, that we're, again, transparent with the data, that we're providing follow-up and talking through outcomes and disparities amongst the groups that we're serving. So now focusing on our vaccination efforts in particular. So this is a chart that identifies where we are in terms of vaccination coverage for Baltimore City residents. In January of 2021, the health department set a goal of 80% of our population being vaccinated by February 2022, so just last month. We are excited to say that in our 12 and up population, 81.4% have had a first or a single dose. If we recall, our 5 to 11 population, their vaccine was approved a bit later in the year, so closer to November of 2021. And so we need additional time to bring that group up to speed. And when I talk about our pediatric population, I'll talk about some separate goals that we've set for that group. But as you can also see, we still have work to do in terms of boosting this population. There was a data breach in the Maryland Department of Health. And so we are working on how we can, again, make sure that we're sharing the disparities. Prior to this point, we had access to the data and we're sharing them broadly on our website. We anticipate having that access and ability again, hopefully no later than next week. But we do see disparities. So though we have 81.4% of 12 and up being vaccinated here in the city, having at least a first or single dose, there are disparities amongst the percentage of Blacks vaccinated compared to the percentage of whites vaccinated. There are disparities when we look at certain ages. And so our younger population, much less likely to get vaccinated, that 18 to 35-year-old group. And that's particularly challenging because often those are the parents of our 5 to 11-year-olds that we want to also get vaccinated. So there is still much work to be done. The other place where we see disparities is in certain CSAs across the city. And so we know that some CSAs, again, going in had less access to healthcare and subsequently might have less access to testing or resources. So we've been very strategic in our approach and where we've placed vaccination clinics, but there are still CSAs that remain challenging to ensure full vaccination coverage. Specifically, and this data is up to date through December of 2021, prior to the data breach at MDH, Cherry Hill, at that time, only about 20% of residents, all ages, had a first or single dose. In Brooklyn, Curtis Bay, Hawkins Point, about 22% had this first or single dose. And this is compared to kind of citywide, 72.5% of all ages having a first or single dose. So what we did early on, again, knowing that there were going to be challenges, knowing that we needed to be particularly focused in our approach to reduce inequities, is we created something called value communities. And so our value communities, again, were those communities identified early on that we knew would either have less access or had been particularly devastated by the pandemic up to the point of us providing vaccinations. And we assign value ambassadors for each of those communities. So there's a focus on our African American population, our young men of color, immigrant, Latinx population, residents experiencing homelessness, adults living with disabilities, pregnant or lactating women, pediatric patients, older adults, and our Orthodox Jewish community. So talking a bit more about that strategy, we've hired almost 120 peer ambassadors, each representing those value communities that I just noted. Those individuals are trained and they live and work in the community that they serve. So we have Micah as a training partner, Morgan State and Johns Hopkins International Vaccine Access Center, who support this group, provide them with training around how to message to the community, how to mobilize in areas where vaccination rates are lower. They talk about the COVID-19 science, because these aren't necessarily science or clinical folks. These are, again, community members, these are peers, but oftentimes they're the best messengers, that neighbor who's encouraging you to get the vaccine versus your physician. We mobilize this group in real time. So the same data I shared about those CSAs with low coverage, we are hyper focused on ensuring our ambassadors are in that area, serving that area, providing education, doing the one-on-one conversation, canvassing ahead of any vaccination events being held, again, calling and texting residents and promoting vaccination and answering questions that residents have. To date, over 112,000 residents in the city have been reached through our value ambassadors. We've held over 350 ambassador events, and over 23,000 pieces of material have been disseminated by our value ambassadors. This is just a very quick snapshot of where we have held some of our value ambassador vaccination clinics in partnership with other healthcare entities. 52 out of 55 of the CSAs in the city have had at least one clinic, representing over 39,000 doses given. Again, that comes to about 1,300 clinics total. Looking at our general vaccination efforts, so this is not just inclusive of our value ambassadors, but inclusive of all of the efforts for vaccination, again, alongside our partners. We've had over 1,600 health department involved vaccination clinics through the end of February, and over 52,000 total doses given through the end of February. So this is inclusive of many of the vaccinations we gave early in the pandemic using our mass vaccination pods. And as you can see, again, we really have tried to focus many of our vaccination clinics represented by that circular blue dot. We tried to focus them on areas in the city that we know have the lowest coverage. So shifting gears a little bit to very quickly talk about our pediatric vaccination strategy. So again, given the late approval for the 5 to 11-year-olds and the anticipated approval of our 6 months to 4-year-olds, we've set a slightly different timeline for this group. So we have set a goal of 80% of our children 5 to 11 being vaccinated by September 30th, and ideally 80% of our 6 months to 4-year-olds being vaccinated by June 30th, 2023. Again, this is assuming we're able to get approval for 6 months to 4-year-olds, possibly later this month, early April, is what we are hearing. So for this particular community, we are really focused on how do we reduce vaccine hesitancy among caregivers so that we can create this demand for vaccine. For our adolescents 12 and up, we have been partnering with city schools. So we have multiple school-based clinics to provide vaccinations. Once 5 to 11 became eligible, we did the same thing. So really working with city schools to identify community schools that there was an interest, that there was support by the administration at that school to hold vaccination clinics. And we'll very much do the same using some existing networks. So our Beamer for Healthy Babies network will help support vaccination for our 6 months to 4-year-olds. And this will happen through outreach to providers as well as parents. So we recognize, especially for 6 months to 4 years old, that pediatricians are such a key figure in those little ones' lives and in the family's lives. And so really ensuring that our local pediatricians feel comfortable providing the vaccine to this age group. They have the information that they need. We're able to provide them with technical assistance. We have also, again, designated ambassadors for this community. So that's including youth ambassadors. So we have some adolescents that are serving as ambassadors, and then we're engaging their families to also help support ambassadors in addition to teachers at schools. Again, we will still hold our community-based clinics in some existing locations, again, where we know vaccination coverage is low, but really want to stress the importance of involving our local pediatricians, who so often are the ones seeing this age group in particular, 6 month to 4-year-olds. So shifting gears to very quickly talk about our testing efforts. So we continue to test every week at multiple locations across the city, again, trying to focus on areas where testing access is a bit lower. We post our weekly testing schedule, so it's accessible online, but individuals can also call into our call center throughout the week and on Saturdays to identify a local testing center. Again, these are testing centers in partnership, some with the state. We have also listed some of our hospital partners who are providing testing. I'll talk a bit more about the rapid testing program we've established with the Enoch Pratt Library, but we do have test kits available through the Enoch Pratt Library, and the federal government is continuing to give out those free tests for individuals who call in or sign up on the internet. So we have also established a community-based organization rapid test kit program. So we had a number of community-based organizations reach out and fill out a form to receive test kits. So to date, we've given about 21,000 test kits to over 350 organizations, each CBO receiving about 60 kits. Because of the increased demand, we have actually tweaked that program a bit and shifted it to really make sure that we're focusing on our value community-specific community-based organizations. So there was a competitive RFP process that we released about a month ago, had about 225 applications, and we will be down selecting to 30 groups, again, those groups being particularly focused on serving our value communities, and provide those groups with about 1,000 test kits. So this way, the CBOs are getting a lot more test kits, and then within that 1,000 test kits, they can give out about 50% to a neighboring organization or group that is also serving that community. In addition, we have a partnership with the Enoch Pratt Free Library, and they've been distributing test kits throughout the week to residents, having given out about 60,000 kits to date. We also support residents who are homebound or have limited mobility. We've provided both vaccinations at home, and we are still able to do that if folks call covax.baltimorecity.gov. Additionally, we have worked alongside our partners in Fire and the National Guard to provide about 886 of those vaccinations and referred almost 600 out to our partners at LifeBridge, B'Cor Shalom, University of Maryland Medical System, and Lutherville Pharmacy. Just a few weeks ago, we also started to deliver test kits to homebound residents through a partnership with Civic Works. And so that is through Civic Works. They have been provided with test kits. They receive the call, they perform the intake, and then they can deliver, usually within 24 to 48 hours, a test kit, as long as it's, I think during the week. I think they don't deliver on Sunday. So to date, as I mentioned, we've continued to test. We've been testing really since April of 2020. We've had 475 different test sites and over 30,000 tests administered by our group. So I will actually stop there. My additional slides are more appendix just in case, but really appreciate everyone's time, and I'm happy to take any questions that folks have.
Thank you so much, Dr. Dzirasa. Please go ahead and put your questions in the chat. Well, I will ask one without putting in the chat to get things going. It sounds like there's just a robust response to COVID and testing and test kits and lots of wonderful goals. My question would be, are there other programs? I know that COVID has really run our lives, especially yours, for many, many months now. But are there other programs that you could tell us a little bit about that Baltimore City is winning on or having success with?
Sure. That's a great question. So one thing I will say in, addition to all of kind of our COVID response, which as you said, consumes a large portion of my time, many of our programs have continued. So initially when everything shut down, we did pull back some services, but for example, our syringe exchange program, which are vans that travel throughout the city, collecting syringes, they never stopped working, even when everything was completely shut down. They did initially see less foot traffic for a period of time, but they have remained within the community, providing additional services. Additionally, our healthcare on the spot van, which is usually co-located with our syringe exchange program and provides buprenorphine treatment to those with substance use disorder. We were able to get them back being active within about 6 months or so of the pandemic. Again, trying to incorporate telemedicine where we could to support those residents, but much of that work has continued. Likewise, our child fatality review, which is a really key part of our maternal mortality and child mortality work, and through our Bureau of Maternal and Child Health, that work has continued. And we recently actually released a 5-year report where we retrospectively looked at all of the deaths of children here in the city from 2015 to 2020. And essentially what we saw is that there was generally, we've seen a decrease in the disparities in infant mortality. Unfortunately, we are seeing homicides in our adolescents, so our 16 to 17-year-olds. So the top causes of death, unfortunately, were homicides and still infant-related sleeping deaths, but significantly decreased disparities in our infant-related sleeping deaths. So that work continues. So much of the work of Be More for Healthy Babies has gone on. So one of the I think strengths of that model is that it's very community-based. And so much of our value communities strategy is taken even from what we know about the success of Be More for Healthy Babies, where you have individuals that live in the community that they're serving that are providing the support and the care coordination. So all of that work has also continued. Another program, school health. So school health, again, even when schools were shut down, they were providing support to parents, helping with medication management for students, and they are right back in it now that schools have reopened. So those are just a few things I could go on. Our clinical services have also continued. We've had to shift our model a bit. We used to allow walk-ins. That's been a bit more challenging as we want to be able to screen folks. And so we don't necessarily have walk-ins, but we do have appointments. And this includes our adolescent reproductive health, family planning, and sexual health clinics.
Thank you so much. And now we have a bunch of questions. So,
okay.
Would you like me to read them off to you?
Sure. I can look at them too. I am good with either way.
Great, wonderful. Yeah, so the first one, can you tell us about efforts to improve maternal health and reduce infant mortality?
Yeah, so our Be More for Healthy Babies program, which I mentioned, that work continues. And so we have multidisciplinary reviews, which include multiple partners. So hospital partners also include community-based organizations, Behavioral Health System Baltimore, to review infant deaths and to come up with recommendations for how we can address the disparities we're seeing. And so we've had additional campaigns launched. But again, it's really working with that provider community, provide them with education, and working with those community health workers that are embedded in neighborhoods that we know had experienced high rates of infant mortality. So Upton Druid Heights, they have a program that supports mothers who are again, young mothers who need support. They'll provide cribs. We still provide cribs. We still do home visits within this community as well. So that work has really, again, maybe paused initially, but has resumed.
Thank you. Oh, here's a good one. What are the gaps in COVID response and goals?
Yeah, I mean, I think that, again, the biggest challenge is that we know that there are disparities with certain groups. And so we know there are disparities in percentage of Blacks vaccinated versus percentage of whites. We know there are disparities in that 18 to 35-year-old age group. We know there is a need for individuals to get boosters. And so I think it's maybe less an access issue because we really, at different points have been running 30 vaccination clinics, again, focused on our highest risk areas, up to 30 vaccination clinics. And that's just us per week. They've been after hours, they've been weekends. And so I guess the one thing we aren't providing is childcare. But I think that we really have tried to create as much access as possible. I will say it was challenging when there was such an increased demand for testing to be able to expand relatively quickly, but have the help of other partners who are in this testing space to kind of address that demand. And so I think what's challenging, and I think it's challenging for government in general, is when that kind of sudden surge or spike hits, being able to very quickly maneuver and shift the response to address that immediate need. I think we're continuing to learn and adjust on how to best do that.
Thank you. Let's see, what grants have you received to support your COVID and other work? Do you have a grants department?
Yeah, probably the biggest grants, at least, and I'll speak both. We have received certainly federal grants. So we received grants from the CDC. We currently have a grant that's supporting evaluation of health disparities in light of COVID. And it also supports building up of our IT infrastructure so that we have access and ability to do better data analysis. We have received ARPA funding. So that's American Recovery something plan act or something. I forget the acronym. So we also will be shifting to use our ARPA funding to support ongoing COVID response activities. A lot of the work that we do for testing and vaccination is actually reimbursable through FEMA. And so again, lots of federal sources of grants at this point. Probably the biggest project we have that did receive some outside philanthropic funding was our Baltimore Health Corps program. So the Baltimore Healthcare Program, which was established in May of 2020, focused on hiring additional workforce rapidly. It was both a workforce development and a public health program that brought in about 250, again, residents who were either unemployed or underemployed as a result of the pandemic. We focused on identifying hires within neighborhoods that had been hardest hit by the pandemic. And those individuals came on board to help with care coordination, contact tracing, and education and outreach within the community. And many of those folks are still with us. And so we'll gradually kind of ramp down as we're seeing shifts in demand for contact tracing. But that program was established through CARES funding from the city, Rockefeller, and many other funders across the city are what made that program viable and made it work.
Great. And
we do not have a grants department. That we don't have a specific grants department. Many of our grants, they fall kind of under the programmatic or section, depending on what the grant is focused on.
I see. And actually, and as an add-on to what you just spoke about, when the assumption, hopefully, as COVID goes away, or we decide to live with it, probably the latter, will this funding eventually go away? And then where will you get your funding from?
Great question. So CARES funding has been expended. So that was kind of the early, if you were following, that was the early, federal funding that came through for health departments. We are now going to be shifting towards ARPA funding. So again, have a period now of some FEMA reimbursement, and then ARPA funding later this year will help to cover, but that also will go away in 2024, end of 2024. And then the CDC funding as well will go away in 2023. So that was a 2-year grant. And so, it will. And so one of the things that we've really tried to build into the grants, on top of just advocating for more sustainable funding from the federal government, but we've tried to build in what does ramping down and demobilization of certain supports look like? That's not ideal, but we are also realistic. So I'm going to use the Baltimore Health Core program as an example. We started off with 250 folks, but over time, we'll kind of gradually decrease that number in waves as, again, we're seeing maybe the need for contact tracing decrease, which is certainly a part of what that workforce does. Likewise, that workforce helps to support our COVID call center. And so ideally, over time, there will be maybe less demand on the COVID call center, and we'll just have to again, begin to kind of demobilize those efforts. I think if anything, in terms of what it would be nice to continue or sustain is I think we have made such inroads in terms of being engaged in the community and being able to actively provide education and outreach. So those value ambassadors, that was a model we used for COVID, but I think it could ring true for so many disease states. And so that would probably be the group that how do we keep, again, value ambassadors, community health workers, whatever you want to call them, really embedded in the community, not just for COVID, but kind of beyond this response. Because one of the things that we often hear from the community is, well, you guys are here now, but as soon as this goes away, you're going to leave. And unfortunately, if we don't have funding, they're probably right. We will have to, shift. And so I think that's probably the biggest need. If I were to say, beyond when some of this federal funding ends, it's how do we keep workers like our value ambassadors and community health workers engaged in the community to help with other parts of what we do, whether it's HIV education and outreach, education on diabetes and heart disease, that would be, one thing that I'd want us to continue doing.
Thank you. Thank you. That's interesting. I think it would be wonderful, yes, if there was some kind of grant that, could pay those value ambassadors. Okay, next question. In one of the early slides, you referred to collaborating with philanthropic community. Could you please tell us about that?
Yeah. So again, I keep pointing to Baltimore Health Core because I think that has probably been the best model of work that we've done to continue to support again just that overall workforce development and bringing folks on, and that was from again about May 2020 or so until August of 2021. So we did extend. It was only supposed to be about a year, but we extended beyond that year as it took us a little bit longer to hire. And we've continued to fund that again through our ARPA funding. But that is certainly a way where we saw, the local philanthropic community step in and help in a big way. And I think that helped to just launch that program again, which we think has been very beneficial to providing education.
Good. Thank you. What can civic organizations do to support your efforts?
Yeah, I think, I mentioned the value ambassadors. I think for us, I understand that it's helpful to have kind of sometimes that one-time funding if you're trying to do pilot projects. And so where value communities, I think, started off, we know this, we have this knowledge, and maybe it'll be a pilot. That probably is the one that I'd want to see continue because, again, I think we can just continue to educate those folks to provide, more information to the community on other disease states.
Thank you. When vaccinations are offered in city schools, do you need parental consent? Interesting.
Yeah, so it depends on the child's age. And so under 16, you do need parental consent. And so, yes, for every vaccine that we've given in schools, we have parental consent. And I think that's appropriate. I'm a pediatrician. I have a 5-year-old. I would certainly want to know if my child is being offered a shot.
Yes. Can you speak to the effectiveness of the vaccine for young children?
Yeah, so at least for 5 to 11-year-olds, and I've not seen any data yet for the 6-month to 4-year-olds, any kind of full clinical trial data, it's extremely effective. And so we know that for 5 to 11-year-olds, it's close to 100% efficacy in that age group. And so I I encourage parents to get it. I have my son turned 5 in December, so he kind of became eligible shortly after the vaccine was available, and we did get him vaccinated as well. And it, for me, as hard as it is sometimes as a parent, I think it gives me peace of mind having a school-age child, and knowing that they're protected in this way.
Thank you. Let's see. Please talk about your work on obesity reduction.
So, I'll be honest, I have not gotten to work on that as much as I wanted to. Like I said, I started in March of 2019 and really spent a lot of my first year developing our strategic plan. And so at the time, I did a series of community conversations with neighborhood groups across the city, but also with special groups such as the LGBTQ community, our young adults, our older adults, adults living with disabilities, to get community input on what they thought should be in our strategic plan. And so I'm very passionate about it, but I will say I have not gotten to do a lot of it. Some things that kind of already existed within the health department before I came was our Baltimore Market program. So that involved making groceries available specifically to older adults. So it's almost like grocery delivery for older adults. And we did have individuals who helped support those older adults ordering their groceries online and then getting it delivered to the senior housing site or senior center, someplace that is convenient. And that program again was done to help encourage healthy food choices. So the person that's kind of helping older adults go through and order their groceries typically can also help with education around nutrition. So would love to do more, but just haven't gotten to do as much around that.
Thank you. I'm curious, as both a physician and a mother and the city health commissioner, how do you feel about the mask mandates going away?
Yeah. So at the city level, we have seen such significant improvement. So if you're following kind of what CDC did a few weeks ago, they shifted their guidance and their metrics to really look at what they're calling community level indicators. And so was on many calls with the CDC trying to understand the science and how they came to this conclusion. And I think, the way it makes sense is that they really are now beginning to look much more at hospital burden as an indicator and as an outcome, as opposed to positivity, because positivity is really driven by the number of tests, and it's driven by actually getting results to those tests. So if you think about now all of these at-home rapid tests, folks don't necessarily have to report those, those positive results. So are we actually getting a true assessment of disease burden by positivity, which is what kind of used to be our big focus? Probably not, with rapid tests, again, being so readily available now. So I understand certainly hear the science. At the same time, I get it. We've been living in this for over 2 years, wearing masks for almost the entire 2 years. And so what I often say, though, again, we lifted it because of, transmission rates in the city per the CDC's new indicators are low. I still encourage people that if you are more comfortable wearing it, you will. If you see me out, I will have it on if I'm indoors. I totally, I think even when we did the presser around lifting the mask mandate, I would say businesses can still maintain that if they like as well. I think businesses can still maintain those requirements if they feel like that's what they want to do to keep their workforce safe. And so I think it's important to just note that even though we're shifting into a new phase, those public health mitigation measures work. And so I think if anyone is more comfortable, then they should absolutely, continue to wear their mask, like I said, as I probably will if you ever see me out. Now, from a school perspective, so my son he's in a private school, but I support their wellness committee. So kind of help to work with them around their decisioning around it. And I think the good thing about his school is, we really do have a sense of the percentage of staff and students that are vaccinated there. And it's a pretty high percentage, which is reassuring. I had a conversation with my son, who's 5, and we kind of talked about, well, maybe when you're indoors, you wear it. And then when you head outside, you take it off, because his school actually had the mask both indoors and outdoors. They were pretty strict. And so just to try to give him a little bit of freedom and flexibility, knowing that transmission rates outdoors are extremely low. And I think he's appreciated that. And so, we actually had a parent council call this week, and it's kind of been mixed. Some kids are still wearing it at his school. Some kids have taken it off. They test weekly at his school. So again, I think that's that other layer of protection that, ideally they're going to identify anyone who's positive early. And I think that that's the key when we look at settings like schools, is what are the other mitigation measures in place as we lift the mask, right? How are we effectively contact tracing? How are we effectively identifying if there is potentially an outbreak at a school? And so that's really what's critical, I think, at this phase, as again, we move to figuring out how to live with COVID.
Thank you. Susan has a couple of questions.
I thought that government agencies were not allowed to accept private funding.
No, I'm not sure I follow. So, I mean, we again have the Baltimore Health Corps program. I know other areas of my department have received funding from Weinberg, Annie Casey. Even when we built our we had a new clinic that was built finalized in May of 2020, and that that received some France Merrick funding. And so we certainly have many programs that have received funding. Now, it might go through the Baltimore Community Foundation or some other fiduciary agent, but we have many programs that are supported by philanthropic funding.
Okay. You had put a slide up that had talked about the first vaccine, the second vaccine, and boosters. Mm-hmm. Many people had side effects from those vaccinations. How is the health department helping those people to get past that so they can get maybe their second vaccine and the booster to help protect them?
Yeah, I think it's still the education piece and really engaging those value ambassadors. Yes, I know many people had side effects, myself included, and it can be tough, right? If you had a level of discomfort or had fevers, chills, whatever the experience was. But I think we still try to very much frame it as you need the full series to get that maximum protection. And we now know that includes boosters, based on the science. And so, I have often told people, I guess it's, yes, you may have side effects for that first 24 to 48 hours, but hopefully, it's certainly much better than what you might experience if you got COVID, or if you got COVID, especially if you got COVID and you were completely unvaccinated, that the risk of hospitalization and severe disease is just much greater without it. So it's trying to kind of weigh the benefits and risk, which I know is a hard decision to make.
Where does the health department or Baltimore stand with patient-centered medical home models?
Well, we fully support them. I think, one of the things is that I don't think there's enough primary care access in Baltimore City. And so I think, and we've absolutely kind of knew that before the pandemic, but certainly have seen that amplified during the pandemic. And so we stand on the side of how do we best advocate for a patient-centered medical home. But I came from a federally qualified health center where PCMH was the model. And so fully support it. I think, again, it's really how do we work best with maybe our hospital partners and healthcare partners, because the direct services we provide are very limited. So I would say, our clinics are very focused on adolescent and reproductive health, family planning, and sexual health. So we aren't necessarily a PCMH, but again, we fully support expansion for our federally qualified health centers and our healthcare systems to be that patient-centered medical home and provide all of the care coordination and support that a patient might need.
And my last question is, how was diabetes affected during the pandemic?
Oh, that's a good question. I mean, I think that, there were a couple disease states where we saw worsening of outcomes. With diabetes, it's still been pretty steady. I think, again, many of those individuals actually still did remain connected to primary care, but we did see an increase in congenital syphilis, for example, and so we are certainly feeling the effects of having less access. So we're trying to identify those individuals early to get them connected to care. We also, again, and this is not unique to Baltimore City, saw an increase in overdoses. There was a bit of a decrease at the beginning of the pandemic, likely because we were kind of all locked in. And then, we have seen an increase. And so I think for us, it's healthcare on the spot. I mentioned our van that prescribes buprenorphine for these residents. And again, going back out into the community and connecting people who have been disconnected from the system back into the system. And so Baltimore City does have what's called a hub and spokes model, with IBR Reach kind of being that hub that refers folks out to places like the spot van. So we continue to work closely with partners to get, again, people who have maybe been disconnected from care for a period of time back into care.
Thank you.
Thank you. Are there any additional questions? I think we've covered. All right. Well, thank you so very much for joining us today. We really appreciate your time, and we are better educated now than we were a little bit of under an hour ago. So thank you again for your time. We really appreciate it.
Great. Thank you, guys.
I do have one question. Is there anything that the Women's Giving Circle can do to assist?
No, I appreciate this opportunity just to talk about the work. I think, if anything, if there's things that you guys want to know more about what we're doing, I'm happy to just get additional information. So nothing immediately comes to mind, but however I can be helpful, please let me know.
Great. All right. Well, thank you again for your time. And
thank you, guys.
Ladies, thank you again for joining us. We really appreciate it. Just a quick mention of our next meeting is actually next Wednesday. Our Full Circle meeting will invite Dr. Matt Freeman, who runs a COVID lab at the University of Maryland. He will also speak about disparities, but he'll likely spend a lot more time talking about disparities within the testing process. And he will also be able to answer any questions about the past, present, and sometimes future of COVID. So please join us next Wednesday at 1 p.m. On Zoom, and another Zoom reminder will be sent out shortly. So thank you again for taking the time. And once again, we really appreciate all of Winnie Borden's hard work, and Harriet's as well. And we look forward to seeing you soon in person.
And I have one housekeeping thing. Rapid tests are available through the USPS, and I signed up for them last week, and they're being delivered to me today. And they're shipping out 4. So if anybody wants them, they're free, and you should look into that.
Okay, good. Thank you. Have a good day. Bye-bye.